From the PEP Radio Newsroom, this is the News Blast for May 11th, 2025. Dozens rallied outside Penn State Health in Hershey Friday, demanding the company continue to save the lives of trans youth. I'm out here today to protect trans rights because I'm a trans man and I believe trans rights are human rights, said Aspen Carroll. On January 28th, President Donald Trump signed an executive order that restricts gender-affirming care such as surgical procedures, hormone therapy, and more for transgender patients 19 years old and younger. On April 4th, UPMC stopped offering such care and released this statement. UPMC is fully committed to providing exceptional care for all our patients. We continue to monitor and comply with directives coming from the federal government that affect the ability of our clinicians to provide specific types of care for patients under the age of 19. We continue to offer necessary behavioral health and other support within the bounds of the law. We empathize with the patients and families who are directly affected by these ongoing changes. On April 25th, Penn State Health announced they would be following UPMC and denying full gender-affirming medical health care to patients under 19 years old. Although two federal judges have blocked the order from taking effect, many hospitals across the country, like UPMC and Penn State Health, have implemented the new order. Corinne Goodwin, the executive director of Eastern Pennsylvania Trans Equity Project, helped organize the rally in Hershey. They are pre-complying because they're afraid, said Goodwin. The trans community, parents, and allies in Hershey showed up to protest Penn State's actions. Parents talked with CBS Channel 21 in Hershey about the impacts of the company's choice to ban gender-affirming health care and how devastating the results will be. It's infuriating to me that healthcare is being restricted in this way. I mean, this can literally save people's lives, said Stephanie Dymek. I mean, this is my kid and their life and their well-being, and I will do anything and everything for them. One mom told CBS 21 that the care her transgender child received made a world of difference, and she is now supporting the other children who might not have that option. I watched it in my own kids go from a shell to a fully alive, blossoming child and fully alive adult, said Jennifer Beck. In response to a request for comment from CBS 21, Penn State Health replied, Penn State Health's updated approach to gender-affirming care is consistent with steps taken by many hospitals and healthcare organizations following a federal executive order issued on January 28th. We deeply respect the right of individuals to express their perspectives and emotions, especially on issues that affect their lives and communities. Penn State Health remains committed to the health and well-being of transgender and gender-diverse individuals and continues to provide compassionate care in a safe and supportive environment. This includes psychosocial support for adolescents and young adults ages 10 through 24 through our Gender Care Clinic. For individuals aged 19 and older, we continue to offer a full range of gender-affirming care options, including surgical procedures through Penn State Health Internal Medicine. Above all, Penn State Health is committed to delivering comprehensive, respectful medical care for all people, including those who are transgender and gender diverse. That's our news blast for this hour. If you will be unable to get to the polls for the Pennsylvania primary election, you have until May 13th to request a mail-in or absentee ballot. Primary election day in Pennsylvania is May 20th. Polls are open from 7 a.m. until 8 p.m. Up next is the weather forecast for the Meadville area on PEP Radio.